Welcome back to another video. Today I want to cover how my recovery has been the past 2 weeks and some of the things that I found necessary for recovery and also some of the things that I didn't think were necessary. So I hope you find this video helpful. So I can't remember the last video I posted, how many weeks out I was from the surgery. As of tomorrow, it'll be 9 weeks post-op, and if I remember correctly, I think my swelling was still there in the last video, so I think it's gone down a lot, but if you look from the side, I think it's a little bit more obvious that the swelling is still there. Another update is that my lip numbness, the sensation is coming back little by little, but at this point I can't say that I'm too excited about it, because in a way I feel the pins and needles a little bit more, and so I feel like talking has become a little bit trickier, because it feels like the lip is dragging when I talk, and I think a lot of it is just in my head, but yeah, it's a little bit it's a little bit tricky to talk these days without either biting my lip or having this incredible lisp out of nowhere. I have asked a speech therapist if I should start speech therapy, but she wants to wait a little bit longer until I have more mobility in my jaw and my swelling to go down a little bit more. So since the last time I did the video, I went to the orthodontist. So that was on December 18th. And it was kind of disappointing because when I went, my orthodontist told me that I still have a lot of inflammation, and so he wanted to wait until March to begin the process again of adjusting my bite. So at that point, it was more than 3 months out. And so I was a bit in shock that I would have to wait that long. A little note, I was at a Christmas party the night before, and I had a lot to drink, a lot of salty foods to eat, and I was pretty puffy that morning, more than usual, so I think that didn't help. So don't do that if you're going to your first orthodontist appointment after the surgery. You want to make sure that your swelling looks as little as possible so that your orthodontist doesn't push it off way too far into the future. But the good news is that this isn't good news. I actually noticed that there's a chip in 2 of my front teeth, and the chip kind of lined up with my bracket, so I thought that it was from the braces. So I decided to call my orthodontist, and they were able to get me in for an emergency appointment. And when I talked to the doctor, he said that it's possible that you're just noticing this chip that's there because my front teeth are in the front. And before, because of the underbite, I couldn't see my front teeth very well. It's so small that it's hard to tell in photos as well, because I have grooves on my teeth. So maybe before I just thought it was a groove in my tooth, and now I'm realizing that it's a chip because it's very sharp. So he wasn't too concerned that the brackets were causing the issue, but he did put bumpers on them. It's not very noticeable, but he put those bumpers on there so that just in case if I ever have like if I ever bite down too hard, it's there to protect my upper teeth. I only went in to get that checked out, but he looked at my bite and he said, you know what, I think if you have time today, let's just go ahead and change out your wires and continue with our treatment. It was a great New Year's Eve present for me, knowing that, you know, I wasn't going to be stagnant for another few months. Because I'm very impatient, and even if changing the wires out means that I'm going to be in pain again, I just wanted to just keep going and hopefully get my braces off sooner than we planned. So the other new thing that I did at the orthodontist was I got new rubber bands. Before I had these rubber bands, which are pretty small, but then I changed them out for these, which are much smaller, and I have to put 2 on each side now. So before, my surgeon was the one who told me to put on these big bands. These were more for physical therapy for my jaw, as that's how he put it. But now I think that these rubber bands are actually supposed to kind of bring my bite together. I mentioned in my other videos, but it looks like I have an overbite at this point. It's not as bad anymore, but before I had like a big gap between my lower teeth and my upper teeth. So I'll demonstrate how I do this. I've done this so many times that I can do it without looking, but I'll show you. It's just not going to be the same for everybody, but I'm going to do this like that, and then I have to put another one here and there. I had two bands in on each side.
I'm supposed to put them on, but I wanted to wait to put it on until I did the video.
So these bands are pretty tight. So now my mobility is a lot more limited. But I think that's how it's supposed to be. I'm allowed to take them off when I eat. So that's my chance to exercise my jaw. And then after I'm done eating, I put them back on. So majority of the time, I have them on. And that's how it's going to be until March, which is my next appointment. So we'll see what happens in these 3 months. As of now, I don't see any visual differences other than the fact that it's pretty restrictive. So, as you know, I've been on the soft chew diet. Eating has become a lot more comfortable. I think I am chewing things that are a little bit harder than what I'm allowed to be eating, but I haven't had any issues. I don't have any jaw popping, or my jaw doesn't hurt, my muscles don't hurt. So I haven't gone crazy. I'm not eating vegetables or anything, but I am eating pizza. The crust is relatively thin so that, you know, I can chew through it. But, you know, like I said, there have been no issues. So hopefully nothing's messed up when I have my next appointment with my surgeon, which is probably in 2 weeks or something like that. So I wanted to go over some of the things that I thought were extremely necessary for your surgery. So the first thing being is the ice machine that I had. It's a little bit expensive. It's I think someone said it was retails for $300 something, but I bought it secondhand off of the jaw surgery group, and I paid about a little over 200, including shipping. And now I sold it off to somebody else who bought it for about 180. So it's worth checking out a group like that to see if somebody is willing to sell their ice machine. If you have the room in your budget, I would definitely buy it. I can't imagine having to change out your ice pack every hour. But with this machine, it'll stay cold for 6 hours, maybe even more. So this is how you use it. You move the handle, the lid comes off. Pretend those salt shakers are water bottles. You can fit up to 6 in there, frozen water bottles, and then you fill it up with water, and it'll stay cold for hours. And you put it back on. Right?
Yeah.
So I hope you could hear how soft it is. It's not loud at all, which is great. So it won't keep you up all night when you're trying to rest. Here, what I'm trying to show you is that you can detach the ice pack part from the tube that connects to the bucket for easy transportation. Even if you have it attached, there won't be a whole lot of water that spills. I don't know how that works, but it's pretty amazing. So this blue cloth is an insulation barrier. You put it on top of the pad so that you don't have direct contact to the skin. It is very easy to take on and off, even though it looks like I am struggling here. But yeah, you can take it off easily. And drooling is a very big part of recovery, so you want to be able to wash it frequently. Once you get the Velcro lined up, you put it at the top of your head and behind your head, and it is very, very secure. It does not move around. It is very comfortable. Highly recommended. Another thing that I thought was very necessary, this goes without saying because, the jaw surgery is very expensive. And don't just think about the jaw surgery cost itself. You don't want to be in a place where you have to think about finances when you're already going through such a tough time. So if you do buy a whole bunch of things before the surgery in preparation, be ready to spend more money after the surgery. There are going to be a bunch of other things that you need to buy, and I can't tell you exactly what, because that's, it's different depending on the type of foods you like, the type of care you need, the type of jaw surgery you have. So the biggest takeaway is that just make sure you have room in your budget to buy more stuff after the surgery. So one of the things that I had is this pediatric electric toothbrush. So this is made for children, but I use this from day one. Right after the surgery, or right after I was discharged from the hospital, my husband went to the grocery store for me to pick up my prescriptions and this. First, the beginning, I could only really go do the front. And of course, I couldn't open my mouth because I had the splint in, but little by little, I was able to go further back. This is the toothbrush I use regularly. So you see the difference in the width here. When I tried to use this, like maybe 4 weeks post-op, like I could not put this in, like it would not go far. So I was very glad to have this. Okay, so the other thing, your hospital might give you a few, but syringes, very important. I would buy a lot because I had 3. I bought 3 from what is it called, craniorehab.com. I bought 3 of those, and then the hospital gave me 3. So even with that, my husband was constantly washing syringes, and yeah, I can't imagine just having one. But This one is a little messed up now since I used it so much. I saved it so that I could do this video. But a little tip, when you use a syringe and if it starts to get stuck, put a little bit of oil here, olive oil, whatever it is, and it will slide in and out very easily. I would recommend you to buy a lot of paper towels. Even if you are very eco-friendly, not that I'm not, but paper towels are pretty important during the recovery phase because there is lots of blood, there's lots of food dribbling everywhere, and I don't know, if you have a caretaker that doesn't mind washing a bunch of towels all the time that has blood, food, and whatever gunk off of it, then, you know, by all means, just have a bunch of towels. But I was very glad to have a lot of paper towels because eating is very tricky during this time, and it's just one less thing to worry about. I would also recommend to have a couple button-up shirts that are comfortable, whether it's like just for lounging or for sleeping. If you have a lot of like overhead clothes, you won't be able to get it on, I don't think, with the swelling that you have. Not only that, I don't think it's good to put any kind of pressure on your face during the first few days of recovery. I would definitely get a wedge pillow so that you can stay elevated when you're resting or sleeping. I just bought mine off of Facebook Marketplace for $40, but if you want something that's brand new, I saw some listings that are anywhere from $60 to $90 range, but I personally don't think you have to spend that much. You can just go on Marketplace and find something that's like a little bit used. Some other things that I did not want to drag in here is a blender. Have a good blender, good enough to blend up meat and any kind of poultry. And as I have mentioned before, I ate Japanese curry for 3 weeks straight for all meals. And in that, I had chuck roast, and that blends up so well. I think the pretty standard blender is the Ninja. It's not too expensive. I think it was like $150, and I got the blender with the cup attachment, the regular big blender, and a food processor. So it was very affordable. Honestly, the blender is non-negotiable. You have to have one because otherwise you won't be able to eat unless you are going to buy prepackaged liquid food, which I think will cost a lot of money. The water pick, I can't live without it. I couldn't live without it before the surgery, and I definitely could not have lived without it after the surgery. Even if you really blend up your food, things get stuck, and the last thing you want is to have an infection when you're already dealing with so much. So I would personally recommend that you get a water pick. Always water pick after you eat, before you sleep. I was lucky enough to not get any infections, and my surgeon was very proud about my hygiene when he took my splint out because there was very minimal food stuck in there. Instant Pot. This, maybe you don't need it, but for the curry that I made, if you pressure cook it for about 14 minutes, the beef gets just so soft and blends up very easily. I don't know how to make chuck roast that soft in the oven. I have never done it because the Instant Pot is just so great. So if you know how to make meat fall apart soft in the oven, then you probably don't need it. But I thought it was really helpful for my curry. And, you know, obviously you can make beef stew You can make, chicken thighs in it with barbecue sauce. But the important thing is that you want to make the meat very, very tender so that when you blend it up, there are no chunks left. I would also get an antiseptic mouthwash. I got one from TheraBreath, the company TheraBreath. It was really helpful for when I still had my splint in. And as I have mentioned before, I used to use Oradel, the hydrogen peroxide mouthwash, but that is not really good for the first few days when you are clogged up here with blood clots and you have the splint in, because it foams up and you have a hard time spitting it out. But antiseptic mouthwash does not do that, but it also sanitizes your mouth and sure to clean out your lesions. I had an antiseptic mouthwash prescribed to me, but I think that the prescription kind is very harsh. So on the instructions, it says don't use it any more than 5 days. And the reason being is because it can cause discoloration on your teeth. So I followed exactly that, and then I just changed to a store-bought one, which is less harsh, but helps keep the mouth fresh. This is another thing that's extremely useful for at least the first 3 to 4 days. You could technically wash your face in the shower when you take a shower, but I don't think I took a shower until day 3. So until then, I was just wiping my face with this, which was very refreshing because you drool a lot and it just kind of gets like caked up. Just don't forget about self-care, I guess. Buy lots and lots of broth. I would buy lots and lots and lots of broth, because you'll just be, you constantly need something to water down any food that you're making. And I bought a 6-pack from Costco, a 6-pack of chicken bone broth and beef broth, and I went through them like that. So I would buy at least 2 packs of 6. And the last thing I thought was incredibly useful was the utility cart that I had. It's not totally necessary. You could just have like a table, like a small table next to you with all of the things just lined up, but I didn't have anything like that, so I bought a very cheap utility cart off of Amazon, and I kept everything on it. I put this on it. I kept my steroid cream, steroid cream in it, Q-tips, tissues, my useless squeeze bottle on it. Here were some of the things that were recommended to me, but I did not use or did not like, and this is one of them. So this is a squeeze bottle, so if you squeeze it, it comes out. The problem with this was because I had so much limited movement in my mouth, I would try to drink water, and every time I pushed it out, I couldn't swallow it fast enough that if I let go, it would suck the water right back out. So basically I was backwashing into it, which is disgusting. I see a lot of people use it, and I heard that they found it useful, but I have a pretty small mouth and my swelling was insane. So maybe that's the combination of those two did not help. And to control the speed of it is also not that easy. So I found it much easier to just drink out of a syringe, or just straight out of the cup, which I was able to do within the first week. Like later, maybe it was into the second week, but I was able to drink out of the cup pretty soon after. I did have to keep a towel down here because stuff would dribble, but again, much easier than the squeeze bottle. I did not use this very much because I don't know, it just didn't do very much for me that a water pick couldn't do. It's more like I treated it more like a toothpick. Like I would just kind of like pick food out. But that's something that my water pick did better. So I don't think this was necessary. I did not benefit from saline sprays. It was recommended by a lot of people on the jaw surgery group in their shopping list. A lot of people say that a whiteboard comes useful. Arnica gel, I don't think I needed that. I don't think it helped very much. If you have the money for it, I did not have this, but I wish I did. It's the suction device, the dental suction device. It sucks saliva. I had one in the hospital, which it was very useful, but obviously I couldn't take it home with me, and I wish I had that. But that problem only lasted about 2 days, so maybe it's not worth the money. But if you are willing to pay premium prices for comfort, I would recommend that. One thing I didn't have that I wish I had is a heating pad. I did have one, but it was a Pyrex food thing, so it wouldn't stay hot for very long. So I did not do any heating. I really did not do a lot of heating because I was too lazy to go heat it up again. I don't know what kind of heating devices there are. The ice machine that I had was supposed to also act as a heat therapy, but you weren't allowed to put boiling water in it. So when I put warm water in it, it didn't feel like actual heat therapy. So I never really used it for heat. Other things that aren't that important, maybe make sure to have a scale to make sure you're not losing too much weight. These are all things that aren't medically necessary, because the things that are medically necessary will be provided to you by your doctor, which are prescriptions, the mouthwash. This is one random thing, which can apply to both boys and girls. I grew my hair out for the surgery because hair is the last thing I wanted to worry about. When it's short like this, I feel like it's kind of like always in your face. It's kind of always in your face, and that's the last thing I would have wanted. It's good to kind of be able to put your hair back for the surgery, had it in a very tight French braid so that I wouldn't have to worry about it even after I woke up. Yeah, so either have it like really short, like pixie cut short, or longer. Unless you're okay with wearing headbands all the time, but headbands, if it's like this, then you can't really get it over your face because of the swelling. Me personally, I just have a lot of hair, so headbands don't really work well for me. And also you get like the scalp pain from wearing headbands, so I just think it's easier to have long hair. I have said this in the other video. But this facial steaming machine, this was $30-ish. Not totally necessary, but it did feel good when you have a lot of pain in your sinuses. But the relief only really lasted for the duration of the steaming process, which was 20 minutes. And apparently you're not supposed to do it too often because it will loosen your pores or something like that. I don't know if I believe that, but that's what it said, and I didn't want to loosen my pores, so I didn't do it more than twice a day. And now I don't really use it at all, so I don't know what to do with it. Last thing I can think of right now is make sure you have like a stool that you can keep inside of your shower, especially if you're doing this recovery thing alone, which I hope you're not. But having the stool in the shower is important because with all of the heat from the hot water and the steam, apparently like some people faint from that. Maybe from, all the blood that you lose during the surgery, it kind of contributes to you feeling lightheaded, and then a lot of people faint. And that's the last thing you want after you sawed your jaw off and nailed it into a new place, right? So that's all I can think of right now. Honestly, the two most important things to have, the ice machine and the blender. You have to have those two. And then after that, I would say is the water pick to really make sure to keep your mouth clean. As scary as this jaw surgery is, there aren't that many things that you truly need. Everybody has different experiences, but I saw these huge shopping lists for jaw surgery before my own surgery, and it kind of freaked me out because I felt very unprepared. But in the end, it really came down to a few items that are totally necessary. So I hope that this video is informative and that it helps you plan out what you need to buy for the surgery and for after the surgery. But like I said, after the surgery, there are probably things that you're gonna need. You're gonna find things that you need that you didn't think you needed before. So make sure you have the room in your budget to make those purchases. So before I close out, I am going to show you my current bite. What's really interesting is before I got these new bands, my lower jaw actually kind of shifted like a tiny bit to the left, which is the side that my jaw was crooked to before as well. So that kind of freaked me out a little bit, but after I put these bands on, it kind of like centered everything again. So your muscles are going through a lot in recovery. Remember a different kind of movement. So it might do weird things and it may not look perfect, but you have to give it time. It's not going to be perfect. You will probably sound funny when you talk. There's lots of funny things going on during recovery, so don't freak out. Just kind of remember that even 2 months after surgery, your body is still trying to heal. I wish I could practice what I preach, but sometimes I chew my husband's ear off about how this muscle right here feels a little bit weird, or how my tooth doesn't look totally straight, or whatever it is. But just, if you're maybe having a bad day, just kind of remind yourself that little weird things along the recovery phase are normal. But obviously check in with your doctor if you think something's horribly wrong. Thanks for tuning in again. I'm not really sure when I'm going to do my next video because life is pretty uneventful. I might do one after my next surgeon's appointment to kind of update you on what he says, since I haven't seen him in a while. Hopefully it'll be all good news and that I'm still healing fine. So I'll see you next time.